A transplant is a lifelong commitment to your child's health. The Children's Healthcare of Atlanta team gives you and your child the support you need. A transplant can help a critically ill child have a more normal life. Before your child is placed on a transplant waiting list, the transplant team at Children's will carefully evaluate what is most appropriate for your child. There are many options for a kidney transplant. Your doctor will discuss with you which option is appropriate for your family.
Really what you want to try to do is make sure that a transplant would be a good option for children, a safe option, screening for things that would increase the risk of failure that would make perhaps dialysis or another choice of therapy a better alternative.
Another probably equally important aspect of the evaluation process is to educate the patient and their family about transplantation, about the risks of transplant, the benefits of transplant, so that they can be very involved in terms of making an informed decision. There's initially some blood tests to look at a variety of factors, including the function of the kidney, urine collection and urine test, some ultrasounds to look at the blood vessels in the abdomen that we would use to do the transplant surgery.
And also looking for potential donors, so either the option of deceased donation or, if possible, ideally family donation or live donation.
If your child is accepted for a deceased donor transplant, he'll be put on the transplant waiting list for an organ. UNOS, the United Network for Organ Sharing, is the national agency that oversees organ allocation and transplantation. UNOS maintains a national computerized transplant waiting list. Your child's ranking on the waiting list is determined by a comprehensive range of factors like age, blood match, geography, patient size, and time on the waiting list.
The reason we like live donation whenever it's possible is because it's a scheduled procedure, which allows us to optimize a lot of things that are a lot more difficult to do with deceased donation. But also the long-term outcomes are really clearly better as well. So the survival of kidney transplant from a live donor is significantly better than from a deceased donor.
The transplant team would speak to the family and speak to individuals who may be interested in donating a kidney to educate the potential donor about what's involved with being evaluated to be a donor.
Doctors determine if the donor is a good match, if the donor's kidney is healthy, and if donation is safe for the donor.
So the survival rate for donors here at our institution is 100%. The survival rate for recipients is excellent. The percentage of children surviving 1 year after a kidney transplant is in the 100% range. The surgery itself normally takes about 3 hours or so. Most of our patients spend 1 to 2 nights in the intensive care unit after the transplant surgery so that we can carefully monitor the function of the new kidney, their blood pressure, and other parameters that are very important to monitor in that early post-transplant period. After the stay in the intensive care unit, they would be on a regular floor in the hospital, and the total hospital stay is generally between about 5 to 7 days.
There are many emotional and physical challenges you and your child will face after a transplant.
Well, children have sometimes different ideas about what transplant means, so we talk a lot about that from a developmental perspective, about what children understand about transplant and having an organ taken out of their bodies or put in their bodies, where that comes from, and to help these families and children cope with very life-threatening conditions in the most appropriate and developmentally holistic way possible.
One of the risks of transplantation is rejection, when the body recognizes that the new organ is foreign and tries to reject it. Our doctors will closely monitor your child's condition after transplant. They'll perform routine evaluations and lab work.
Now the risks of rejection are really quite low relative to what they were in the past. The medicines we have do a very good job of largely preventing early rejection episodes. It's still something that comes up. Perhaps on the order of 15-20% of the time, people will experience a rejection episode. That doesn't mean you lose the transplant. What it means is you need an adjustment in the medication or additional treatments.
I think Families really need to understand that transplant is a treatment. Transplant is not a cure. And we try to make sure throughout this process that they're clear on what the treatment options are. Then we try to set up what support systems or educational pieces that they need. Always the goal is at the end to have a successful transplant, and that requires trust and commitment and compliance.
Taking the medicines exactly as prescribed is absolutely crucial to a good outcome. So the medicines we have now do a really great job of preventing rejection, but they can only prevent rejection if you take them like clockwork. Compliance isn't just about taking the medicine, it's also about coming for all the follow-up and getting all the screening blood work that would be used to detect problems. So compliance is really an important part of success.